BusyBox's expert information on dermal fillers. What are dermal fillers?
A dermal filler is a substance that is used to give volume to the skin usually. It can come in different compositions, and the most widely used composition in aesthetic medicine at present is hyaluronic acid gel.
Where are the common places for dermal fillers?
The most common places where you would put a dermal filler, the most popular, would be the what is called the nasolabial lines or folds, which is the lines that they go from the nose down to the mouth. This is a very common place to put it, and a place where you tend to see very good results. Another place where you can put it is to give enhancement to the lips, or to treat lines that are around the lips, like for example what is called the perioral lines or the smoker's lines. Another place where you can put it would be this area here, which is called the glabella lines, okay, the frown lines. That's another area. And then there is many other areas that they can be used, like for example for volume. You can reshape the nose, for example, with dermal fillers. That's one very specialized use of it, but it's something that I tend to get very good results. Many places where you want to put volume, actually.
Are dermal fillers permanent?
The one that is the mostly used, which is hyaluronic acid, tends to last about 8 to 12 months in the majority of cases. However, it changes a lot between individuals. So a person that has a dermal filler, for example, in the lips, because the lips, they move a lot, there is direct relation between movement and how quick the product degrades. So for example, in the lips might last you 4 to 6 months. I'd say that yes, I mean the dermal fillers like hyaluronic acid, they last a few months. That is quite a lot, about 6 to 8. That's probably is a good a good figure. Then you have the semi-permanent dermal fillers, which is other compositions, not hyaluronic acid, which can be something like calcium hydroxylapatite. It's actually nothing more than the mineral composition of the bone. I know it sounds terrible, but it's like a sort of a gel that as well can last quite a long time. Then there is another kind of filler, which is the permanent filler. Usually, that is called permanent because the product does not degrade. Your body cannot break it down little by little. That obviously uses, it's used to make a permanent change that it won't go away.
What happens during a dermal filler treatment?
To do a dermal filler treatment, you should anesthetize the area that you're going to treat, because without anesthesia, most of patients wouldn't like it. You anesthetize it with two ways. You can use a cream for about half an hour or an hour, which will reduce your sensitivity, or you can use normal local anesthesia, most likely lidocaine, which is the same kind of anesthesia that, for example, your dentist would use. Let's say that you're going to treat the lips. Well, then you put the injections in the lips, and once the anesthesia is there, then what you're simply doing is you injecting in the areas that you want to create volume. Obviously, where you inject it is as important. How you injected your technique is as important as the product itself. It is not especially painful. The patient might feel a little bit of pressure. It's not supposed to feel pain. If you feel outrageous pain, it's not right. You have to tell your doctor. And that's it. After the treatment, it looks red and swollen. Sometimes you can bruise. It's a possibility. But the most likely is that it just simply looks a little bit inflamed. And it would last like that perhaps about maybe 1 to 2 days. If it's the lips, it might last a little bit more. If it's an area like this one or this one, it might last less.
Who should avoid dermal fillers?
You cannot treat a person, a breastfeeding or pregnant woman. I mean, obviously that goes without saying. You cannot treat as well people that they have known sensitivity to the product that you're going to inject as well. It's quite logical. Those are usually the main contraindications. And then, of course, you cannot treat a person that has what is called unrealistic expectations, meaning that if somebody comes to me with the lips of Angelina Jolie and says, I want this, I will say no. I will have to explain the reason why. I cannot do that because your face is individual, your face is like a canvas. We work on that, but it's, you cannot actually recreate, somebody else's.
Do I need to take time off work to have dermal fillers?
Usually not necessarily. However, for somebody that has dermal fillers in a place that's very visible, like let's say the lips, I usually advise that they have it done, let's say on Friday. So they have Saturday and Sunday to recover. The usual is that if you have dermal fillers right now and then you go back to work, most likely it's going to be noticeable because you're going to have redness and swelling.
Are the results permanent?
Yes, because what you're doing with the dermal filler is you're doing a mechanical correction. You're injecting something that has to be occupying space, so that occupying space will create the volume that you desire to occupy. However, because there will be an additional inflammation, it will look perhaps a little bit exaggerated. So you have to wait a few days for the swelling to settle. And usually you review the situation in 2 weeks' time, where all the structures and the inflammation has settled, and then you have a clear idea of how is the result.
How many dermal filler treatments do I need?
It depends again on the composition that you will use. You might use hyaluronic acid, you might use, I don't know, polylactic acid. It depends. If I use hyaluronic acid, which is the most extendedly, the most used, with one single treatment, you're supposed to see results. Usually you don't have to touch it up, if you know what I mean. Obviously, if you're a person, if your doctor is not very confident in the, in his or her technique, makes sense that might do the thing in 2 stages. Okay, but in the majority of cases, with one application of hyaluronic acid, you tend to see results.
How long do the results last?
Hyaluronic acid, the most widely used, tends to last about 6 to 12 months. Let's put this, that will be accurate. It varies a lot between individuals. A semi-permanent dermal filler, like the calcium hydroxylapatite, might last 2 to 3 years. And then a permanent one like polyacrylamides, which is the other composition, the one that is permanent, might last, well, indefinitely unless you take it out.
How much do dermal fillers usually cost?
Usually dermal fillers are charged by the number of syringes that you use, because they come pre-packed in a syringe. So the moment that you open that syringe, either it's used or it has to be discarded. So it's logical that you pay per syringe that you're using. Usually one syringe is about £300. Sometimes you see it at £250, sometimes you see it at £350. But the usual is around the price of £300.
Do I need a patch test first?
It's not necessarily a patch test, because what is called the biocompatibility of hyaluronic acid has been demonstrated. Statistically, there is more or less a chance every about 10,000 patients, and those are figures that they keep on changing, because these treatments are exponentially being carried out throughout the world, and more is demonstrated that is a very, very safe treatment. So there is no need for patch test.
Is the procedure for dermal fillers painful?
With proper anesthesia, they are not supposed to be painful now.
www.busybox.com